Well, in the news conference tonight, President Trump announced that Vice President Pence will be leading a White House coronavirus task force. And members of that task force, including CDC leaders, expressed both optimism and caution.
Our aggressive containment strategy here in the United States has been working and is responsible for the low levels of cases that we have so far. However, we do expect more cases.
Now, tonight, we want to try to answer some of your questions. Let's start with this. What is the closest case of coronavirus to Minnesota? Well, according to the CDC, the closest case is in Wisconsin. Nationally, the CDC has confirmed 15 cases in these states in the red. There are another 42 people who got the virus on the Diamond Princess cruise ship off the coast of Japan, and they are now being quarantined in the U.S. Now, many of you have also asked, is there a vaccine? In the news conference tonight, the CDC said they are moving faster than ever to move several vaccines into trials, and that could begin within 2 months. However, it could take another 10 months of trials after that before a vaccine is ready for the public.
So although this is the fastest we have ever gone, the answer to containing is public health measures. We can't rely on a vaccine over the next several months to a year.
Now, without a vaccine, others have asked, how do I prepare to protect my family from the coronavirus? The CDC still says approach it like the flu. Cover your cough, wash your hands, and stay at home if you're sick. And if you do need to keep yourself home.
You'll want to make sure that you have enough food for a week. You want to make sure if you're ill and you have medications that you take, that you have enough medications for at least a week, if not 30 days.
At 1 p.m. tomorrow, the Minnesota Department of Health will update us on its coronavirus preparations across the state. We'll share that information on KARE 11 and KARE11.com as soon as we have it.